150,000. Just a few months ago, that number was considered unfathomable. But today we crossed that unfortunate milestone. 150,000 Americans' lives lost to the coronavirus. And while COVID has proven no age group is immune, from the beginning of this crisis, it's the elderly who have faced the greatest risk. Deaths in nursing homes account for a third of all COVID-19 deaths nationwide. And now with states like Florida recording record deaths, we wanted to know what lessons we've learned from the start of this pandemic and what's being done to protect the greatest generation. Our Kaylee Hartung leads us off with the efforts now underway to keep nursing home residents safe.
Tonight, Judy Irish is struggling with a reality all too common across this country.
Well, actually, I still haven't touched my husband since March 19th. I am very lucky. I do get about an hour a day through a door.
As the nation continues to battle COVID-19, Judy's separation from her husband of nearly 40 years is just one example of the challenges nursing homes present. 5 months into the pandemic, with ongoing state visitation restrictions, some continue to be criticized for poor communication, and some families worry their loved ones' conditions are deteriorating. President Trump last week announcing efforts to support them.
Nursing homes in higher risk areas will be receiving more funding. This money can be used to address critical needs, including the hiring of additional staff, increasing testing, and providing technology support so residents can connect their families.
There's now over 142,000 confirmed COVID-19 cases in U.S. nursing homes, and 38,518 residents have died of the disease, according to the Centers for Medicare and Medicaid. But an ABC News analysis of state-by-state data finds this is likely an undercount. We first spoke with Judy Irish back in April, and today, over 3 months later, she's still unable to go inside Rivers Bend Health and Rehabilitation in Wisconsin to see her husband, Bob. They can now meet outdoors, 6 feet apart, but she says that's not enough.
There's a new CNA or a new nurse. Why are these people able to be screened to come in and do hands-on care, and I can't?
North Shore Health, the facility's parent company, saying this in a statement: "We understand how frustrated our families are related to their inability to visit their loved ones in our center. While following the guidance set forth by the CMS, CDC, and other health authorities has not been easy, it has helped keep our center free of the virus for both residents and staff." Judy's not alone. Miko Cook's father is an Alzheimer's patient at Hudson Park Rehabilitation and Nursing Center in New York. And at the height of the pandemic, her family wasn't able to see her father, Ron, for over 100 days.
The facility had told us there would be video calls. And my sister tried for like 6 weeks to get a video call, and it never happened. And we were so frustrated that finally I went to Facebook and just unleashed.
She says they were finally able to see him in a video chat after a social worker broke the rules and used her own phone.
Somebody calls back and says, "Oh, we've never done video calls, and we don't even have the equipment to do that."
Miko now runs this Facebook group where members are sharing similar stories. Susan Bernstein's father, Walter, nearly died from pneumonia in April. He was treated at the hospital, then sent to Excel Care Center in Florida.
I was able to get him his cell phone, so I would just call him. Or he would call me. And there were days when he was calling me up to 10 times a day because he was so unhappy and things were just not, he was not being cared for the way, he felt he should be cared for.
She has since been able to bring her father home from the nursing facility. The Hudson Park Rehabilitation and Nursing Center and the Excel Care Center did not immediately respond to ABC News' request for comment. Florida today setting a new record with COVID-19 related deaths for the second straight day. Family members are concerned that without their close personal involvement, their loved ones in nursing homes aren't getting all the care they need.
My family was going in there almost every day. My dad, being an Alzheimer's patient, needed that constant interaction with them so that he just had a sense of place and time.
We've heard that concern echoed by nursing home staffers, and some have gone above and beyond to help protect residents from the virus, even moving into this facility in Ohio, as profiled by our Diane Sawyer in May.
These administrators, nurses, aides at 2 assisted living facilities, Sharon Brook and Chapel Grove, decided if the enemy was heading to their doors, they would go inside, lock that door, and fight to keep it out.
I have 124 grandparents here. So, I mean, that was a big thing for me.
The team is reportedly moving back into the facility again, their first day resulting in 0 COVID infections. In New York State, the Department of Health is allowing limited visitation of nursing homes as long as those facilities have been COVID-free for 28 days. For Miko's father, Ron, the nursing home where he currently lives says there hasn't been a case there in over 3 weeks.
We could just get, a qualified access plan where one person can be in there, one family member per person can be in there no matter what. It would alleviate so much stress on so many sides.
Kaylee Hartung, ABC News, Los Angeles.
Hi everyone, George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel, and don't forget to download the ABC News app for breaking news alerts. Thanks for watching.